Yeah, your nipple could die from your breast lift surgery. But does it happen very often? No, but you still have to be aware of the possibility. So if I haven't scared you away yet, let's get into the possible complications of breast lift surgery, starting from your more minor to the more major complications that can happen sometime in the first 6 weeks. Now, this video is not meant to deter you from considering this type of surgery. It's more to educate you so that you're better prepared for what to watch out for in the post-op period. With that said, let's get into it. Suture spitting. This is a minor nuisance more than a complication. Over the course of the postoperative period, you may notice, depending on the type of suture your surgeon used, small white fibers, or even firm, sharp protrusions from the skin. These little areas are the sutures that are working their way to the surface after your surgery. For some patients, they can be bothersome, such as causing inflammation around the area, and sometimes can make the scarring more intense. Other times, these little sutures work themselves to the surface and then fall out on their own. My suggestion is to let your surgeon know if you have a bothersome suture or one that has drainage coming from it. So that way they can either have you come into the office to have it removed or give you instructions on how to handle it. Me personally, I like to have my patients come in so I can cut it out at the appropriate time, and then we can decrease the risk of that inflammation is going to get worse. The next complication to look out for is, what if you can't feel your nipples after surgery? Now, this is a total possibility, as all the sensation for your nipples comes from the nerves originating from the sides of your chest, and any surgery around the nipple, like in a breast lift, always has a risk of losing sensation or even decreasing sensation to the nipples. If this occurs, we just have to wait. A large amount of the time, the sensation returns over the next 6 to 12 months and everything is back to normal. In some cases, the sensation does not return. So if your nipple sensation is paramount in your life, as for some people it might be, you may want to have a long conversation with your surgeon about what can be done to minimize the risk of this happening. This is usually a little bit more of a risk whenever breast implants are placed or a lot of tissue is resected from the kind of outside portion of the breast. But in general, the risk of this occurring is really low. The next complication that can occur is the triple point breaking down. The triple point is the area in your breast lift where the vertical incision meets the horizontal incision in the middle of your breast fold. This area is the area that's under the most amount of tension because these sutures in this area are holding back all of your breast tissue and even supporting the weight of that new implant that maybe you got with this surgery. If this area opens up, you need to let your surgeon know, especially if you have breast implants. The reason being is that it needs to be monitored to make sure that it doesn't open up further. Now, it may just open up slightly and that's the end of it. Worst case scenario, it opens up to a larger wound that needs daily local wound care. In any event, that little area needs to be monitored closely to make sure that it doesn't get worse. Another complication to look out for is redness developing in the breast. Areas of the skin on the breast in the weeks after surgery that turn red, painful, and swollen need to really be watched, especially redness that is spreading across the breast. This is a sign of possible infection and again needs to be reported to your surgeon as soon as you notice it. Sometimes a small area of redness can be managed with oral antibiotics if it's caught early enough, but if it's allowed to spread and persist for a while before any intervention is done, it could result in the need for IV antibiotics in the hospital for a few days. Now, even if it gets to that point where you're in the hospital getting IV antibiotics, there's a chance that the breast implants may need to be removed because if you're getting sicker or fail to respond for the antibiotics, then likely that infection may have gotten down to the breast implants and those will need to come out. Things you can do in the first few weeks to decrease the risk of developing cellulitis is to really complete your whole course of antibiotics. The other thing you can do is to make sure that you wash your hands before touching any of the dressings on your wounds. It's easy to pick up a lot of bacteria on your fingers and quickly transmit that bacteria to your wounds without even knowing it. This next complication is pretty rare and can result from a number of reasons. Breast implant extrusion. Now, this means that the breast implant has broken through the wound and is visible in the wound bed itself. This can happen for a number of reasons. One is the progression of an infection in the breast that causes the implant to become infected and the incisions break down due to that infection. Other reasons can include poor technique in closure or even placing too large of an implant during surgery that creates too much tension on the wound. In any event, the breast implant is now visible in the wound bed itself, typically at the region of the triple point. How often does this happen? Extremely rarely. The reason being is that in a breast lift, there are often multiple layers of breast tissue between the breast implant and the skin before the implant can even make its way out of your body. I close my breast implants over a layer of breast tissue with 3 layers of sutures before I even begin the 3 layers of sutures to close the skin itself. But the most dreaded complication of a breast lift is nipple necrosis, otherwise known as nipple death. Is this a common occurrence? Again, no, it is not, but it could still happen. And before we talk about this, let me just say this. You are going to be your best advocate for yourself when it comes to complications from surgery. So if you are concerned about something, you need to let your surgeon know about it. That's easy to do here because at my practice, I see all of my post-op patients. But for those of you who end up seeing another provider who was not directly involved in your surgery, then you need to advocate for yourself if you are concerned about something. That way it can be discussed and addressed in a timely manner. So how can your nipple die during a breast lift? Well, when we do a breast lift, we're not detaching your nipple from your chest and then putting it back on at the end of the case. We actually isolate your nipple and areola on a peninsula of tissue that keeps the deeper layers of the skin intact. If we make the base of it wide enough and preserve enough of the dermis, then your nipple survives the lift. If the base of the tissue that the nipple rides on to its new location is not wide enough, or if the peninsula is excessively long, like think of lifting your breasts from hanging down around your knees, or if the peninsula is squeezed too tight after the skin is closed over it, then the blood flow to the nipple could be restricted, resulting in your nipple dying. So what do we do about this? Well, if it is noticed while we're closing, every board-certified plastic surgeon is trained to stop with the closure and release some of the sutures to see if the blood supply begins to come back. If that fixes the problem, then we can begin to reclose. If it happens again, we repeat the process, making changes to see if we can improve the blood supply each time. If it improves, then we close like normal. If it fails to improve every time, then we have to make some decisions. One option involves actually removing your nipple and areola, thinning it out really, really thin, and then reattaching it to your breast where the nipple would go as a skin graft. Now, why would we do that? Well, because the nipple reattached as a skin graft has less metabolic demand than if we left it on, so we have a higher chance of actually keeping that nipple. The downside is that sensation to the nipple is typically lost with this intervention. But if we get improvement with just releasing the sutures around the areola, but it still doesn't tolerate being fully closed, then there's a chance you could wake up with the nipple and the areola loosely inset, so there might be some gaps in between the closure. The reason for this is that we're trying to allow the blood supply to get to the nipple, and by closing it all the way, we're just making it too tight. So we're gonna allow the blood supply to strengthen over the next few days, and if that does occur, then you'll end up meeting your surgeon back in the office a few days later to finally close the nipple areolar complex under local anesthesia. But what if the nipple turns blue after you've gotten home? In that case, you need to let your surgeon know right away. They're probably gonna try and arrange to meet with you as soon as possible, and that way take a look. So after your meeting, if everything looks okay, you may be prescribed a cream called Nitropaste. Now, this medication can help improve blood supply to the nipple, along with any warm packs placed around the areola and nipples, so that way we can cause dilation of your blood vessels and try and get some more blood in there. If there is more concern about the nipple, then sutures might need to be released to relieve some of that pressure and hopefully allow some better blood flow to the nipple. But what if the nipple dies? Unfortunately, that can happen, and when it does, there are going to be some steps to go through before you can get back to having a nipple again. If it's just a small area of necrosis, then that can be debrided slightly sooner and then it's going to be allowed to heal. But if it's the whole nipple, then you're going to want to wait it out for a few weeks as the dead tissue falls off and then the healthy tissue begins to show itself underneath. In the end, breast lift surgery is overall a safe and rewarding surgery for so many people. And in the case of a problem with your surgery, the more you know, the better your chances of having a better outcome. But if you do experience any of these complications, there is a chance they could make your breast lift scars more prominent. In that case, you're going to want to watch this video right here where we discuss the management of your breast lift scars and how to make them less noticeable. I'm Dr. Paul Pearce, a board-certified plastic surgeon here in Austin, Texas, and I hope you learned something today. Hopefully I didn't scare you too much. Hopefully not. Either way, we'll see you in the next video.